Well, I guess we'll go ahead and get started. Welcome, everyone. Thanks for joining us for a discussion of new and ongoing workplace trends in the era of COVID-19, presented by two of REDW's top human resources consultants, Kristen Haynes-Bosselman and Lisa Enkoff. Kristen heads our HR consulting practice and has extensive experience in HR management and strategy. She also brings a legal perspective as a former litigation attorney specializing in employment law. Lisa brings more than 20 years of experience serving in a variety of HR roles and is especially skilled at transforming organizational operations and culture. But before they get started on today's session, let me just cover a few housekeeping notes. At the bottom of your screen, you'll see a Q&A icon. Just click on that to open a window where you can type in any questions you may have during the session. Our speakers are going to wait to address them at the end as time permits. And at about this time tomorrow, you'll receive a follow-up email that provides a link to a recording of this presentation, as well as a copy of the slides. Well, we have a lot to cover today, so I'm going to turn the mic over to Lisa to get us started.
So good morning, everyone. Thank you all for being here and joining us with this webinar. We'll be covering projected trends for the workplace in 2021 and COVID-19. We will be looking at whether or not vaccines can be mandated. Should they be? And what are the legal considerations for employers, and what is the best approach for your workplace? And then we'll move on to talk about workplace safety as well as leave policies for employers. And we have a lot of great material to cover today, so we will be moving through the material quickly. But good news is we have our contact information at the end of the presentation so that you can reach out to us afterwards. Next slide, Carla. So I can't tell you how many times I said, sorry, I'm on mute in 2020. Certainly last year was unprecedented. Definitely, I think remote work was demystified for a lot of employers who saw that they could operate effectively with a largely remote workforce. And even our own REDW has experienced the benefits and the opportunities associated with remote work. Will this be a trend that continues in 2021? Absolutely. I think employers will be looking at how to leverage hybrid, remote, and office work policies to navigate the pandemic. The other interesting piece for the workplace is going to be automation. We'll see more of that, as well as digital transformation. Employers will be saying, do I have the right technology in order to deliver business results? The other thing that will be very important in 2021 is the presence of the hourly worker. Right? More and more we're seeing they are running our economy, whether it be grocery stores, retail, food and beverage, hospitality, construction, trucking. Okay, what would we be doing without FedEx and UPS right now in this environment? So, they'll be looking at employers and saying, you know what? Are you taking care of my security, health, safety on the job? So from a safety standpoint, we have a big opportunity for COVID safe workplace policies, which we'll also cover, but also from a recruitment and retention standpoint, employers are going to be under that employee eye to say, how do you retain us? How do we be competitive in the workplace? Lastly, we want to look at empathy and engagement-based leadership. Very important in this environment as we talk about implementing different programs to identify those opportunities to really lead with listening and engage our employees. Moving on to the next slide.
I have to add, Lisa, it's hilarious.
Yes.
I just got a notification from Amazon that my package is being delivered today. As you said, that trucking is incredibly important right now, and FedEx. I thought that was funny.
Yeah, you can't time these things, right? They just happen organically. So thank you. We're going to cover the workplace vaccination program piece now. Before we get started, we'd like to do a quick poll. And so would you like to mandate vaccines for employees in your workplace? So we'll give you 20 to 30 seconds to respond. And then Kristen will be our in-house legal expert and practice leader will be taking us through those considerations.
It looks like we've Answers are slowing, and I'm going to end the poll now and share the results.
Oh, this is interesting. So we've got 39% yes, 33 no, 28 unsure. So, okay. All right. Well, Ms. Kristen, it would be great if you could walk us through the law.
Well, it certainly looks like, based on those poll results, that this is the perfect time to be doing this webinar. So thank you guys again for joining us. So the first thing I want to talk about is, to ease your mind a little bit, employer mandated programs are absolutely legally permissible. They are currently 100% up to employer choice, with some legal considerations that I want to go over with you today. I also want to add a quick caveat that right now, all of the vaccinations being offered in our country are currently under emergency use authorization, which means they don't necessarily have full FDA approval. I assume that that approval is forthcoming, and we just need to keep an eye on it because, Lisa and I were discussing it this morning that no matter how we set up our vaccination program, if we don't acknowledge that under emergency use authorization, anyone can refuse a vaccine for any reason. And so we need to make sure that before we act on a mandatory vaccine program, that, I encourage you guys, reach out to us. Let's talk through the consequences of that before we discipline or let anybody go until we have full FDA approval. So that was an interesting consideration. So in terms of the EEOC, Title VII, and the ADA, so we need to make sure that if we create a mandatory vaccination program or a hybrid program that's requiring any employees to get the vaccination, that we build in an exception for religious accommodation, because a sincerely held religious belief, I know Jehovah's Witnesses are one category of religion that typically refuse these types of medical treatments. So if you have someone who has a sincerely held religious belief, and again, offline, if you have a question about that, reach out to us and we'll go through that analysis with you. But if you have that, then we need to look at making sure that we make a religious accommodation. Accommodations in and of themselves have to be reasonable, and so we can talk through that as well. The same goes with ADA. So interestingly, as the CDC came out with the list of high-risk conditions that can make individuals more likely to suffer more extreme reactions to contracting the COVID-19 virus, the EEOC adopted that list of high-risk conditions as conditions that would qualify as a disability, at least temporarily, under the ADA. And so we need to be careful there, because what we imagine is going to happen is that's going to nicely segue over to individuals who are looking at getting a vaccine. If they have any of those conditions, we think that they would also be eligible to request an accommodation under the ADA. And so those types of conditions, as you've seen, I mean, there's anything from heart conditions, obviously any lung conditions, to obesity. So we would really need to carefully analyze that through the interactive process under the ADA. Like I said, when we're thinking about accommodations, we do need to consider whether or not the accommodation is reasonable. And so we have found, especially with one of our larger clients, when physical presence in the workplace or direct contact with other individuals is an essential function of the role, then we do not have to offer someone a remote work accommodation. And so that's been the case under COVID and under people looking for ways to work remotely with the virus. I think it's going to be the same with seeking an exception to the vaccine. And so we really need to look at what types of accommodations can we offer. And so instead, I think that's going to look more like, for those individuals with essential functions that require being in person, That's going to look like more PPE. It's going to look like, additional, obviously mask requirements are part of this. But we've looked at extra distancing. We work with the school district, and we've talked with them about, these certain individuals, these teachers who are experiencing these conditions, can they teach a class in the gymnasium so that they can have extra distance? Those types of things are, we need to get creative when we're looking at ADA accommodations. So again, encourage you guys to reach out if we can help you with the interactive process, because it can be a little challenging. Also, great time to make sure you've trained all of your leaders on how to recognize when an ADA or religious accommodation comes up, because as we all know, employers never walk up to you and say, I need a religious accommodation under Title VII, or I need an ADA accommodation. Instead, it's going to look a lot like someone saying, oh my gosh, I'm just really worried about this because I have this heart condition and I just don't know if the vaccine is safe for me. So when something like that comes up, they need to refer to your HR, and HR needs to do an interactive process interview and talk them through it. So I wanted to quickly touch on, because I know we have some of our wonderful tribal clients on the call. I'm going to try to make sure that I refer to kind of the impacts on tribes despite sovereign immunity. In this case, we would want to look at what policies and procedures the tribe has adopted. So has the tribe adopted an anti-discrimination policy? Has the tribe adopted something that resembles the ADA or Title VII? And if so, we need to make sure that we're following those policies and procedures carefully. So with that, I'm going to turn it over to Lisa, because she's my guru on OSHA, and she's going to chat with you about the general duty clause under OSHA.
Yes, so as I look at our slide, these are like stepping stones of analysis, and certainly, after the ADA and EEOC, really looking at what OSHA has to say. OSHA has a general duty clause, which basically says that employers need to provide a place of employment free from hazards, recognized hazards that could cause death or harm. So this raises an interesting question for the type of vaccination program. For example, would a voluntary program put employees at risk? And on the flip side, would a mandatory program raise concerns of safety, where an employee says, I have a reasonable belief based upon my medical condition or health that this could cause serious harm to me? The other thing we really also want to look at is whistleblower protection under OSHA, which gives employees a venue to raise safety concerns without fear of retaliation or reprisal. So that is a key piece of OSHA. Interestingly, in 2009, OSHA did issue guidance about the flu vaccine. Similar to what Kristen just mentioned, employers can mandate subject to possible exemptions under the ADA and EEOC. The OSHA has been silent recently, so we're assuming, we don't have definitive guidance yet, that they would take the same position, but that is also helpful to know. Kristen, can you talk to us about unionized and non-unionized workplaces and the National Labor Relations Act?
Sure can. I'd be happy to. I did want to just go back and mention really quickly again on the tribal side of things. There's been quite a push and pull over whether OSHA applies to tribes or not, and there's all kinds of fun information leading all the way up until, I think there was the last case I saw was in 2019. So still hotly contested, but I do think that anytime Lisa mentions OSHA during our webinar today, it should be a consideration that when we're talking about workplace safety, I think it's really about recruiting and retaining talent, and that that's an area where tribes probably have, if they haven't already, would want to adopt those same safety protocols just to take care of people. So with that, the National Labor Relations Act, a lot of us, including me, when I was a VP of HR, I remember hearing something about the NLRB, the National Labor Relations Board, at one point, and I was like, oh, well, that doesn't apply to me because I don't have unionized employees. Well, that's not true. So if you were just about to shut your ears off, make sure you're considering employees always have the right to collectively discuss, object to, or protest any type of actions in their jobs. But in this case, the employer mandated vaccine program. So even non-unionized employees could go to the NLRB and could make a claim that they have decided that they are collaborating just on this issue and that they have created their own bargaining unit and they can ask for help with that. And so we just want to make sure that if you have a group of employees that come to your door and say, we don't want to do this, or we're objecting to the program that you're putting in place with regard to the vaccine, that you take that seriously and you handle it as if it was a collective bargaining unit. So I think that's just a really important consideration. Just carefully consider what they're looking for, and try to maybe mediate that and reach the point of a reasonable situation. So that's all I've got there. State law, on the other hand, so states have the legal authority to require their residents to be vaccinated. It obviously hasn't occurred yet. We haven't seen any states that have done this yet. It was funny to me because initially I thought, that sounds crazy to think that the state can mandate me having to get this vaccine. And then I thought, well, actually, it's not crazy at all, because I'm sure everyone on this call got to get their measles, mumps, and rubella shot in middle school, and all of the other different childhood vaccines that are required by states to attend public school. So this is going to fall under that same legal framework. And then, of course, requiring healthcare workers to get vaccines has also been mandated. The flu vaccine, hepatitis, things like that are often included in medical practices policies. So what you want to do is just stay on top of this, checking local government vaccination requirements. Right now, with the new presidential administration, we haven't seen any inclination to federally mandate a vaccine. I think that would be just a giant mess if it was intended. I think that there might be good intentions there, but not in the form of government that we have. So I think that the messaging we're going to see from the administration going forward is just going to continue to be do the right thing. And I think that what we're talking about today and how to set up these programs, and what Lisa will go into momentarily, is really, we're all looking at how can we do the right thing for our people and for our customers, or whatever segment of the public we're working with. So Lisa, can you think of anything else, any other maybe special considerations that we want to go through here? Any special situations that might come up for our attendees?
Sure. Well, certainly, as we go through this topic, pregnancy. So the potential for that being a high-risk condition under the ADA. And so the CDC has issued guidelines saying we recommend pregnant women get the vaccine, but they may elect not to do so. And the risks of the vaccine are thought to be small, but are not known. So I think that's just something to be aware of should you have an employee raise a question or express an accommodation request. And then also for child labor, the vaccine, the Pfizer vaccine, can be administered to those 16 and older, Moderna 18, and there are tests going on for children under 16, I believe, with Pfizer currently. But if you do employ anyone under the age of 16, that is also a consideration as well.
Excellent. Okay, we can move on to the next slide. And Lisa, why don't you take it away with different types of programs?
So here are a few proposed programs: mandatory, so required, hybrid, voluntary, and really important to keep a neutral framework around your business, essential job functions, and is there a high risk of exposure and close contact? And so what does that really look like? So if we go to our next slide and just break this down a little bit further, this is actually a framework that has been adapted from CISA. So there is a cybersecurity agency that's part of DHS that has published a framework to say, what are essential jobs to our economy? How do we evaluate the safety? And there's some really interesting categories here that also coincide very nicely with EEOC guidance about risk assessment, especially when we're looking at accommodations. So let's talk about settings. So is your work indoors or outdoors? How is the ventilation? Have ventilation systems been updated per state guidelines in this environment? So those are some things you'd like to, consider with your setting. Proximity. How closely do people work alongside one another, or how proximate are they to customers, patients, visitors, vendors? With contact types, does your work environment have a lot of shared contact surfaces or items? Do your employees have physical contact with, for example, patients or customers? And then with duration and frequency, how long is that contact? How frequently is that happening in a work day or work week? Other risk factors are, am I likely to come into contact? Do I have a high risk of coming into contact with someone with COVID or high risk of exposure? You know, one thing I would really encourage from a legal standpoint, and a lot of times, again, in that engagement piece, we know things about our employees, is to not use that knowledge, let's say of a medical condition or, you know, a health census to say, do I mandate the vaccines or not? I think really focus on the job content, and that will give you a lot of answers. And so, Chris, what scenarios, what have you encountered? You know, what types of questions are you getting?
Well, that's what I was going to say, like thinking about how this analysis applies to our clients. I was thinking, you know, what does this look like for a medical practice versus a construction company versus maybe a professional services firm? Because I imagine, you know, as you mentioned, REDW has been able to take this and run with it. And we have, you know, remote work opportunities, flexible scheduling, things like that. So to me, a professional services firm could probably more easily fall in that voluntary program. Whereas I wonder, what do you think about like a medical practice? Where do you see that falling on this spectrum?
So, you know, I think it would point to a mandatory program, you know, depending upon the composition of, let's say, administrative or back office staff. You know, and construction is another similar industry. You know, you may have a percentage of your workforce that is engaged in close contact, proximity, very frequent, right, high risk, and you might have a hybrid program to say for these safety sensitive positions, we're going to require vaccines. For these types of positions, we're not.
Right. And I think also an interesting one, I have a client that you would think would, you know, it's all office based. There's not a lot of public contact. So you would think that they would probably be able to do voluntary and have some remote work and have some flexibility. But once we started to dig into it, we discovered that, oh my gosh, everything that they do is on paper. They don't have cloud-based systems. And so we had to kind of backtrack and go, well, wait a minute. I think that being physically present in the office environment is actually an essential function, because you can't complete this work without this significant investment in infrastructure that they don't have. And so we started backtracking and thinking this might have to be a hybrid situation, because we think that the people who cannot do their jobs in a remote environment or cannot distance are going to have to get the vaccine in order to be safe. And so that was an interesting one. So we do, you know, like you said, considering the individual role, not the person in the role maybe, but the individual role in determining, you know, what do they do on a daily basis and whether or not they have to be there. So I thought that was really interesting.
That absolutely is. And I think this type of analysis as well lends itself well to workplace safety policies, which we'll talk about in a little bit, but this will guide the demographics of your workforce in terms of job function and say, what practices should I put in place beyond the vaccine?
Yeah, and I think it's funny, this actually segues perfectly into the next slide, into, you know, what are the considerations here? So Lisa, you take that one away.
Yeah, so let's talk about cost. Right now, the vaccines are available, you know, at no cost. As things stabilize, as we get to the new normal where, you know, the vaccine's widely available, you know, what options are there? Will insurance cover it? Will an employer cover the cost through the programs or, let's say, flu shot clinics that it provides? So that's just something that you want to be thinking about now and really looking at what resources are available at a state and federal level. And then with administration. So again, right now, the state's making these vaccines available through phased distribution. But would you as an employer like to eventually have an on-site clinic where the employer is administering the vaccine or contracting with a third-party provider to do it for you? So if you decide to go those routes, you do want to look at Pre-screening questions. So the EEOC has issued specific guidance on vaccine pre-screening questions to make sure that employers are not going beyond the scope of what is needed to administer that vaccine and opening the door to more knowledge about disability. Because the moment that as an employer you have knowledge about disability, it really triggers that interactive process. Is there an accommodation needed? So you want to be thinking about that. Now, another option would be to go to the employee goes to an outside provider, your local pharmacy, their doctor, and they bring you proof of the vaccine. And again, in communication, best to let your employees know you do not need to give me specific medical information, just simply proof that you've been vaccinated. So that may be one way to manage. If we go with a voluntary program, the EEOC says, okay, it's a voluntary program. You can't require your employees to answer medically related questions before getting the vaccine. So again, somebody refuses it, that's where you say, okay, what's the next step in that process, especially while we're under emergency use authorization. So lastly, voluntary, very interesting. We talk about wellness programs and providing incentives. The EEOC has said gift cards and water bottles are great to encourage people to take the vaccine, but their guidance is anything beyond that. Let's say a PTO day or some other form of compensation could be seen as almost coercion in a way. That's a bit of a strong word, but there's a concern that our employee relations don't go that route. And then ultimately with communication, you really want to be thinking about strong messaging and engagement strategies to encourage adoption. Internal marketing really goes a long way to engage employees positively.
I was going to say, that what you just said about the coercion it's an interesting thought. I mean, I think it's a fun idea to have like special Band-Aids or something cool like that. But I was thinking, there's been so much sharing on social media. A lot of my friends are healthcare workers and I've seen them saying, look, I got my shot. And I would think employers would need to shy away from that, like any kind of yay for this employee because they got vaccinated. I think that would probably be a good thing to stay away from as well, even though I think a lot of people think this is something really to celebrate. You're right. There are people who could have, like we talked about, deeply held religious beliefs or underlying health conditions that they don't feel comfortable, and then they will suddenly feel like they're being, left out or looked down upon for not getting the vaccine. So that's a really good point.
Which actually raises another great point, which is record keeping, communication. If you go with a mandatory program, that administration side, you do have HIPAA considerations. Everything has to be secured. How will a mandatory program be enforced? As well as not sharing who's gotten the vaccine or who has, or who, for whatever reason, has opted out because of exactly what you're describing, Kristen.
It almost sounds like it's really important to have a very clear policy in place, which is why we are always preaching to our clients, and this is no exception for sure.
Yes.
Yeah.
So I guess we're ready to talk about the next slide. And so we're on to workplace safety. So really, really interesting. So the CDC has this amazing tracker on its website that actually tracks how many people have been vaccinated. So as of earlier this week, we've had 14 million people who've had one or more doses. 2 million have had 2 doses of the vaccine, which also goes back to policy considerations on availability of the vaccine and lots of other unanswered questions. So what we do know is the vaccine has tested 95% effective with Pfizer to prevent infection, but has it or will it reduce the risk of transmission? Not clear. That was something that was not tested in the initial trials. So that is a question mark. And again, availability as well. Israel has been making, and I know this is a bit of a digression point, but they've been making the headlines because apparently studies are coming out of that country that's saying, you know what, these vaccines are reducing transmission. So interesting to just watch some of those developments and hopefully they'll guide us on what to do next. But all of this ultimately points to COVID-safe workplace policies. We need to have them and keep that as our foundation. And so, Kristen, I would love to hear your thoughts on that.
Yeah, it's funny. I keep looking at the map that they show on the news every morning, and I get really encouraged by the fact that all the states are getting back into the green, and it looks like transmission is going down. And then, of course, my husband is like, "Well, that's because the Christmas holiday is over." I'm like, "Oh man, I thought for sure." But no, I think that there's obviously some efficacy of the vaccine that we're starting to see, which is very exciting. On to workplace safety. So unfortunately, as much as we we thought that perhaps the end of 2020 would be the end of all of this, it is, it's not. It did not take the virus with it when it left. So in the meantime, it's important to remember, if you haven't already established these policies, now's as good a time as any. If you did establish these policies at the outset of the pandemic, it's a great time to pull them out, dust them off, review them. A lot has changed, and so it's a good time to check it out. And also, adding that vaccine program to these policies, it's a great place to put everything together. So we need to make sure that we are continuing all of the same protocol: masks, PPE, hand washing, social distancing. We have encouraged our clients to nominate a safety liaison for anyone who is working while physically present in the office. That person can be the one who is handling the medical screenings when people are coming in. They can also be the one who's tasked with the reporting that's required, that Lisa will talk about here in a little bit. And also that person can be the one that goes around and makes sure that every hour or every however many hours you elect, that they're wiping down handles and wiping down knobs in the restroom and things like that. And so we've encouraged that, and giving that person a little title and maybe a little spot bonus or bump, if that's something that's within reason for you. Again, revisiting your remote work practices and guidelines as well. What about travel? What are you doing for that? Probably need to check that out and update it. And then, of course, Lisa's going to cover more on the leave policies that, we have a voluntary extension of the FFCRA she's going to talk about, and what you should, what do you want to do in terms of leave for your people? Because the purpose of the FFCRA, as we all know, the purpose of offering some kind of paid leave is to incentivize employees not to come to work when they are sick. And so it's a good time to look at that and say, well, even if I'm not required to do it anymore, is there anything I can do to incentivize that? So I'll transition this back to Lisa and her OSHA knowledge to share a little more with us on that.
So OSHA record keeping requirements are, definitely a consideration, as well as it relates to vaccine administration. If somebody does have, a reaction, there are certain reporting requirements employers need to adopt and ensure. Also consider your workers' compensation. But OSHA has basically said that COVID-19 is a reportable illness. And there's a really nice analysis framework that basically takes an employer through, is this a work-related injury? There's an investigative component. So it's not an automatic slam dunk that someone gets COVID-19 and it's automatically related to work, but we do need to ensure we're following the record keeping requirements. And the other piece that OSHA is very focused on are just hazard plans. Have employers gone through that? So just with any citation activity recently, that's what they're really looking at. Is there appropriate protective equipment, your PPE? If I think of a healthcare environment, do you have the right respirators? Have employees been trained on how to use them, how to put them on? They're really focused on those types of practices as well. And so as we move on to the next slide, and this is just the final section of our webinar, we'll be talking about workplace leave policies and providing a brief update. And so we'll cover voluntary FCRA leave provisions as well as tribal considerations. So on the next slide, we are not going to go in depth into FCRA per se, other than just to say the mandatory piece of the program ended for employers December 31st. So employers have the option to voluntarily continue that leave to employees who did not exhaust their 2020 balances of leave through March 31st. The caveat is, and it's a term called double dipping, that the payroll tax credit is not available to you if you're using PPP funds to pay for that leave. So that's just something to keep in mind from your payroll perspective. And then moving on to the next slide and talking about FCRA. Okay, so we have that option, right, to offer that leave. You want to ensure you're offering the leave under the same framework with the same tracking methods. And then that's really just a springboard moving forward. So past March, what would you like to do with leave provisions? Interestingly, FCRA does not cover time off due to vaccine reactions. So if you do implement any type of vaccination program, what will those options be if I needed to take a day off? Employers can dictate the scheduling of when vaccines are administered to employees to balance some of those scenarios as well. So that's just another consideration. So when you look at paid leave, look at your state, county, your city requirements. What are the workplace scenarios as it relates to COVID? What are the work-life balance scenarios where you can really use your leave policy to engage and retain your employees? You say, wow, I just have this employer who just really facilitates that balance with my work and private life. Also, New Mexico has some legislation that's being considered now to mandate sick leave throughout the state. So this is something we definitely want to keep an eye on as it may affect your current leave policies in place. And I think we'll know more on that, by March or April of this year for a July 1st date.
That's what I was going to say. I think it's a July 1st implementation if the legislature does approve it.
Yeah. And Kristen, what are your thoughts too about tribal considerations or anything related to paid leave?
Okay, so yeah, if we move over to the next slide, there we go. So this is an area where tribes with CARES Act funding left, which given the extraordinary delay in payment, that's probably most of our folks on the call. So the tribes have probably by now decided if they were going to go ahead and adopt or continue offering this paid leave. But in the tribe's case, it doesn't have to end on March 31st if CARES Act funding is being used to pay it. So this is an allowable use of that funding, and as well as hazard pay programs, which I know we've worked with a lot of our clients on developing hazard pay programs. So if you're using CARES Act funding, then through December 31st, there's, you can create leave provisions that are under the same framework, or, beyond March 31st can design your own and continue to use those funds, I believe. We'll talk more about that though, if that's a decision that you decide to make. In terms of the tax credit associated with continuing to offer the FFCRA framework, need to make sure that that's being paid out of actual tribal funds though, because if we're using CARES Act funding, that's the same idea that Lisa just said about PPP loan, no double dipping. I had a client this last week that said, but wouldn't that be nice? It's like, that would be nice. I agree with you, but unfortunately, that's not gonna work out. So making sure that you're reaching out to the experts. There are so many different situations that we've seen. And so we want to make sure that that we're here to help kind of analyze the different nuances as they come up, because as you've noticed today, there's just so many different legal considerations that are milling around and playing a part in all of this. So we're doing our best to figure out ways to balance that for our clients. So let's see, I think we have next slide. All right. So of course, thank you for your time today. We do have one more poll question that we wanted to go over with you. So leaving, what's your strategic priority today? And I'm not going to lie, my strategic priority is the last one. I'm looking forward to happy hour later this afternoon. But I'm interested to know because we want to always be able to focus our preparation and services around what's important to our clients. And so I'd love to know what you're looking at first here.
I'll give it a few more seconds. A few answers are coming in. All right, I'm ending the polling and sharing the results.
Excellent. Okay, workplace safety. That is great to know. And I think that, like I said, you're right, because the virus didn't magically disappear when 2020 left us, we definitely should be focusing on workplace safety. So wonderful. We are absolutely here to help with that. And we want to open it up now. We left enough time that if there are any questions we can answer on the call, we'd be thrilled to answer those now. Before we open it up to questions, I do want to just quickly thank my amazing colleague Lisa and our just fabulous marketing team and marketing team member Carla for her help with the webinar. This has just been, I hope, really, really informative to you guys, but it's been great for us to take the time to put it together as well. So does anyone have any questions? If you do, throw them into the chat to the panelists and we'll take those at your leisure. And don't worry, if you don't have questions or you don't like being the type to throw them out there, you're just like me. It takes me a minute to process things, and then that's why you have our contact information here. You're welcome to reach out to us separately.
Well, I'll just take this opportunity to thank everyone myself. Thank you for joining us, everybody. So as I mentioned earlier, you should receive a follow-up email at about this time tomorrow. It'll contain a link to a recording of this presentation. You can listen to it again on demand, plus a copy of today's slides. And a quick evaluation form is going to pop up on your screen once the session ends. We'd really appreciate if you can take a minute to just provide your feedback on today's webinar. It's just a few questions. So, well, thank you, everyone. Have a good rest of your day then, and stay safe.
And I'm going to give everybody my absolute favorite gift to give anyone, which is a gift of time. So there's about 18 minutes of your day back. Thank you guys so much for joining us.
Thank you.